Now I get to introduce you to Howie Frumkin. Like Jonathan Patz, who joined us last night at our sort of kickoff reception at the New England Aquarium, Howie is another absolutely central sort of founding father of this field. Howie was the director of the National Center of Environmental Health, the CDC, and then a special assistant to the director for climate change and health from 2005 to 2010. He went on to serve as the dean of the University of Washington School of Public Health until 2016. We could actually spend the next day and a half talking about the mountain range of Howie's achievements and involvements, but that would just depress us. So I'm just going to say that Howie is a good friend, a deeply valued mentor, and it's a huge pleasure to have him here with us today. Thank you.
Thanks so much, Sam, for that nice introduction. Thanks, Michael, Michelle, for opening so beautifully and inspiringly. Thanks, Jonathan, for last night's tour de force. Special thanks to the team here at Harvard for pulling together this incredible meeting. This is going to be a fantastic day and a half, I know. And as I tackle the question of what is planetary health and why now, thanks to the friends and colleagues who gave me useful advice and brainstorming. Anything that I get right, give them the credit. If I get anything wrong, I'll take the blame. Well, let's begin back in historical time. Arguably, planetary health originated here in this picture of the bottom of a Scottish coal mine in the mid-19th century. Coal had, of course, been recognized for at least 1,000 years and used on a large scale for a century or more. But by the time of this image, it was making energy available on an unprecedented scale and revolutionizing industry. I like this picture. If you take a close look, you'll see that the gentleman who's sitting at the bottom of the coal mine saw fit to wear his wig instead of a hard hat and is lighting something up. It may be a pipe, it may be a firecracker, I'm not sure. Either way, it demonstrates beautifully the reckless insouciance that would characterize energy policy for the next 150 years. Or perhaps planetary health originated here at the Drake Well in northwestern Pennsylvania. Drilled in 1859, this was the first commercial oil well in the United States and possibly in the world, although Azerbaijan has a claim to that distinction as well. Liquid fuel represented another form of plentiful energy, and before long it revolutionized transportation and gave rise to a booming synthetic organic chemical industry, among other things. All that plentiful energy had a profound effect. You've seen these iconic images from Will Steffen and colleagues depicting the great acceleration over the last 2 or 3 centuries, and especially in the last century. Just since 1950, human population has almost tripled. Real global GDP has increased 7-fold. Fresh water use, more than 3-fold. Primary energy use, 5-fold. Fertilizer use, more than 10-fold. And this human activity, as everyone in the room knows, has had profound impacts on Earth's systems. Rising levels of greenhouse gases, a warming planet, a more acid ocean, alarming losses of fisheries, forests, and biodiversity. The Great Acceleration changed the world and the human relationship with the world in literally epical ways. It ushered in a transition from the Holocene, the dozen millennia during which civilization as we know it emerged, to the Anthropocene, a time of profound and rapidly evolving changes in Earth systems. As Christoph Rossall and colleagues wrote in a recent issue of the Anthropocene Review, this term, Anthropocene, and I'm quoting, pointedly captures the fact that industrial society has made it into the ranks of deep time, bringing about a geological epoch that has no analog in Earth's history. But of course, it's not just that we are changing the future of the Earth. The Earth changes also shape us. This iconic image, and I know everybody in the room has seen this as well, represents a safe operating space for humanity. The idea that there are limits that, if transgressed, may threaten not only Earth systems, not only human health and well-being, but the very basis of civilization. There's active debate around this image, the idea of specific boundaries rather than continuous variables, the debates between global and regional implications of these changes, but the image powerfully conveys the notion that we need to live within limits. And that recognition, in turn, has given rise to the concept of planetary health, a concept that, like each of us, has a rich and varied ancestry. What is planetary health? Well, Jonathan used this definition last night during his talk. It can be defined simply as the fusion of two domains, the health of human civilization and the health of natural systems on which human civilization depends. It's a simple definition, but an absolutely vast concept. Perhaps as described by Timothy Morton, a conceptual hyper-object, an entity of such vast temporal and spatial dimensions that it defeats traditional ideas about what a thing is in the first place. Here's another possible definition for planetary health. This one emphasizes that planetary health requires us to be systems thinkers, applying ecological approaches to the health sciences in ways that those of us with medical, nursing, public health, or veterinary degrees never learned in school. But perhaps the best way to characterize planetary health is to explore its ancestry, a sort of 23andMe search of the genealogy of an idea. Where do we come from? Well, one line of descent lies with global health. This field originated a century ago with what was then called tropical medicine. Health professionals, usually white male doctors with walrus mustaches, accompanied colonial expeditions and settlements, hoping to protect colonialists from newly encountered infectious diseases. The term tropical medicine survives in the names of distinguished institutions from London to New Orleans, but for the most part it yielded to a newer term, international health. International health addressed not only the health concerns of colonialists, but the health of populations in low-income countries. Laboratories and schools in wealthy nations trained experts, carried out research, and otherwise built a field with, by the way, the great support of the Rockefeller Foundation just before Michael got to work there. More recently, global health has come to replace international health, bringing with it the sense of truly reciprocal partnerships between wealthy and poor nations, stressing the importance of building local capacity in the global south, and in the last few years, expanding its scope from infectious diseases to non-communicable diseases as well. Global health also addresses population health issues in wealthy nations, sometimes in deprived multi-ethnic communities in the very shadow of prominent academic medical centers. The next shift from global health to planetary health reflects a further expansion, the recognition that human health and well-being cannot be understood or protected apart from the health of the ecosystems on which we depend. This step implies an integration of environmental thinking with biomedical thinking. It does not imply that global health will be subsumed by planetary health or go away anytime soon, but rather that a critical new dimension will be added to global health. But the urge to combine environmental thinking with biomedical thinking isn't new. Conservation medicine, a term introduced in the 1990s, in many ways anticipated planetary health. The next decade after that saw an exciting blossoming of related ideas, interdisciplinary efforts, publications, and organizations aligned around the general notion that animal health, human health, and ecosystem health needed to be addressed jointly. At the same time, as the health impacts of climate change became increasingly clear, this area emerged in parallel. The political context is different, and there is a strong emphasis on both adapting to and mitigating climate change in ways that protect health. But the area shares a lot of DNA with the others shown here. The notion that to understand the complex determinants of human health, we need a thorough understanding of the physical and biological processes that define our environment. In fact, Earth Sciences represents a separate line of descent of planetary health, and a special shout out to the American Geophysical Union for its role in today's meeting. Earth scientists and ecologists have long understood the need for systems thinking when approaching complex phenomena. This insight, together with the content area expertise, is an essential part of planetary health. There's important common ground in the idea of ecosystem services, the idea from ecological economics that the natural world provides services to people, that those services can be valued, and that based on that valuation, we can more fully appreciate the natural world and better incorporate it into our thinking. One key ecosystem service is, of course, human health, or perhaps it's more accurate to say that numerous ecosystem services support human health. Of course, the core disciplines and paradigms of public health are a key part of the genealogy of planetary health. These involve thinking on a population scale, thinking about the root causes of disease so that prevention can be emphasized, and putting the most vulnerable people and communities at the center of our practice. The public health perspective increasingly is coming to be associated with upstream thinking, with a focus on social and environmental determinants of health, on such domains as agriculture, transportation, housing, urban planning, and energy policy as essential levers in protecting human health. This approach is sometimes called Public Health 3.0. Finally, ethics is an essential strand of planetary health. Ethics is the discipline concerned with distinguishing between good and evil, between right and wrong actions. There's a fundamental moral claim at the heart of planetary health. More about that in just a moment. So with this rich and varied background, and with all the hybrid vigor that it implies, where are we today? What is planetary health? I'd suggest that it has at least 5 distinct identities as shown here. Let me address each in turn, both making some observations and raising some questions. First, planetary health is a field. A field is a set of institutional arrangements such as journals, meetings, the things we're doing today. This slide is behaving strangely. That's my first observation. Next observation, this is an unusual field because the things we do through other fields, such as agriculture, urban planning, and so on. This is not an autonomous field. Now that's better. We are an emerging field. We're still relatively fragmented, but we have the strength that the fragments like each other. We get along well and we're very aligned. This raises a set of questions. Do we need to consolidate? Do we need a consensus statement of identity of who we are? Do we need to structure meetings in different ways than we traditionally have? And we'll see that in the next couple of days. How do we cultivate research and training support? And how do we facilitate careers for young entrants to the field? Second, planetary health is a scientific paradigm. The great biologist Dobzhansky famously said, "Nothing in biology makes sense except in the light of evolution." The planetary health version of that may be nothing in human health, well-being, thriving, or survival makes sense except in light of planetary health. A big claim. The intellectual paradigm involves systems thinking, as I mentioned earlier, with all of the features of systems thinking that you're well familiar with. One observation I'd make, and Michelle mentioned this clearly, is that universities built of silos are deeply unready for the task of dealing with such a cross-cutting set of challenges, and we need to be thinking about university structures and research structures more generally. Do we need more systematic reviews? Do we need a Cochrane-like process? Do we need a research agenda as we advance this scientific paradigm? Third, planetary health is a policy framework, and here I want to give a big nod to Michael's comments about the importance of translating the science into action. As we do that, as we offer scientific input to policy, we need the input to be anchored in the needs of decision makers, so we need to be in active dialogue. We need to be anchored in the perspectives of the individuals and the communities we serve. This will be most efficacious and have most impact when applied to specific challenges, such as feeding people, providing energy to those who need energy, and so on. Policies are crafted and implemented at many spatial scales, at many temporal scales, and they differ from north to south. The challenges of a mayor and a city arborist deciding what kinds of trees to plant in their city to mitigate the urban heat island, to provide shade, to clean the air, to improve mental health, are very different than the challenges of global negotiators working on biodiversity protection. Should we be distilling data into indicators, or are there other things that we can do to make the science more amenable to policy support? Fourth, planetary health is a communication strategy, a way to frame and communicate the tough challenges we face in the Anthropocene. I'd make a few observations. The first is that the term planetary health may be a little wonky. It may not have a lot of traction as a communications tool. The second is that complexity, which is at the heart of what we do, confuses. Numbers numb. That's why they're called numbers. But pictures persist. Stories stick. So those of us who are scientists need to learn to communicate effectively, and that often means using tools that are different than the ones in our comfort zone. Who are the audiences to whom we want to communicate? What are the core messages we want to convey? What are the most compelling ways to tell those stories? Finally, planetary health is a moral imperative. We all talk about equity within public health, and that's a good thing. Those of us who come from clinical backgrounds are very familiar with the bioethics core principles, but we may need a new ethic for the Anthropocene, a new ethic to drive the concept of planetary health. Perhaps it's the concept of human prosperity in a flourishing web of life. Maybe that's the ethical vision. Perhaps our mandate is like something like this. Human civilization is a precious and beautiful thing, and when it is threatened, we are called to rescue it. An observation I'd make is that language like this, the language of morality, the language of conviction, is very different than the language that you'll hear at a scientific meeting. That suggests that we all need to learn to get comfortable with that language. We need to form partnerships with faith communities and others who think and talk about morality and ethics, because it is at the core of what we're about. So, with that as a jumping off point, let me finish by returning to a question. And I want to return to this iconic image and ask an ethical question about it. This is the image of planetary limits. Images are very powerful, and this image has indeed been a very important trigger of essential ideas. But is there anything missing? Are there constraints to our thinking that we may inadvertently accept by accepting this image? Well, it's a very simple image. It's as simple as a pizza pie. It consists of slices, and the action in this image is linear action. There are limits, the arrows move centrifugally, and the idea is that we may transgress those limits. A pretty simple concept. Simplicity should always be suspect. What are we missing here? We all know that reality looks more like this, and this is the simplified version, so this is quite a different image than the image I just showed you. Well, one question we could ask as we interrogate that planetary limits image is, what is missing from it? For example, what's in the middle of this image? This is just a bunch of points meeting. There's not much going on there. You can redraw the image this way. It's basically the same picture. It has the label ecological ceiling in the circle, and you can see that arrow, which may be too small to read, but what it says is overshoot. The notion that this conveys is that there is a limit beyond which we shouldn't go. Fair enough. And the middle is empty. What might go in the middle? Within the circle, we can situate human needs and the resources required to thrive. This image shows several human needs in the center, probably too small for you to read. Basics such as food and water, opportunities such as education and employment, networks of information and social support, human rights such as equity and political voice. Here, overshoot isn't the problem. Instead, it's shortfalls, the arrow moving in toward the center. A minimum level of each factor shown is needed to assure human thriving. The donut that results represents the safe and just space for humanity, characterized by a regenerative and distributive economy, as described by the economist Kate Raworth. There are limits beyond which we shouldn't go, and there are limits below which we shouldn't go. Both as a practical matter and as a matter of planetary health ethics, we need to embrace both sets of challenges. This, I'd submit, defines our work in planetary health. Well, I've argued that planetary health is a natural evolution of a wide range of traditions in biomedical science, earth science, ecology, economics, social science, and ethics. I've argued that planetary health is emerging as a field, as a scientific paradigm, as a policy framework, as a communication strategy, and as a moral imperative. It has enormous power and promise in each of these ways. This isn't just an academic exercise. We need planetary health. We need it because our house is on fire. We face urgent threats to our survival, to the health of human civilization, and to the natural systems on which we depend. We need new ways of thinking to guide us to the best solutions. And make no mistake, planetary health is a radically innovative step forward. We need relentless, courageous, mission-driven action based on the best science and on ethical conviction. We need hope and optimism. That's what planetary health is, and that's why now. Thank you.